trying to figure out as a barber, how can we inform clients about options with hair loss? Like, we got so many clients coming in that are losing hair in corners, losing hair in the crown areas. You know, first of all, can you tell me what your profession is?
Yeah, so I have a PhD in regenerative medicine, and I work in aesthetic dermatology as a medical director, which means I get to do clinical trial research, some innovative research, and really in the field of dermatology, plastic surgery, and aesthetic medicine.
So that means you know what you're doing, huh?
I've spent a long time studying a lot of these things.
You got 1 or 2 credentials. Good stuff, good stuff. So, you know, we done talked about, you know, the different types of balding. What are some of the standard types of balding that happen in men?
Yeah, so most commonly the hair loss experienced by men is androgenic alopecia, which is genetic, and it is a result of essentially testosterone binding to hair follicles and essentially choking them off from a blood supply. And so, you know, there's not really anything that somebody does to have that start. But there are genetic factors that play into it. And for men, you'll notice first usually hair loss in the temples. And there's a scale called the Norwood scale that you can sort of use to judge where you're at on sort of on the hair loss spectrum, if it is indeed androgenic. And the good news, a quick fact here, is that in general, you will lose about 50% of your hair until you notice, and
wait, time out. How much?
50% until you start to notice.
So is that density per square inch?
Yeah, overall density. And then what's even more interesting is people don't start to notice until you've lost about 70% of your hair.
The thinning process.
The thinning process.
So what's the average count per square inch density on someone's head?
It varies super dramatically. So the things that sort of the hallmarks, like you mentioned, your density will decrease. And another thing that will happen is, you know, there are certain people that are just born with lower or higher hair density. I'm sure everybody can imagine that. But another factor is the actual size of the hair can decrease. So the diameter of the hair shaft itself will decrease as you progress.
What is that? Is that due to like the follicles shrinking or
Yep.
the blood?
That's exactly.
Okay.
Yep.
Okay. So I like to tell a lot of my clients, like a lot of African American men come in and they want waves, right? You see this, you know, forehead or hair, wavy curly texture, whatever. And when the wave curl is stretched out, it turns into a wave. So they wear what they call do-rags. And so when you wear that do-rag, they're tying it around areas of their hair. This area, and lower nape area of your neck. And so what I'm seeing with a lot of guys is they're losing density and thickness of the shaft of the hair. And my thought is, and tell me if I'm wrong, because you're cutting off that blood supply, then you're creating lack of oxygen in blood, which closes up the follicle, which then thins the hair out, which then leads to baldness in those areas.
Yeah, this can definitely be a contributing factor. You know, another really interesting factor that that kind of gained, I think, awareness was, do you remember maybe 2015, 2014 when man buns became a thing? So pulling your hair back or stressing it can cause a different type of alopecia, hair loss. That's called traction alopecia.
Okay.
And so just the mechanical damage of pulling hair tight, or like you said, restricting oxygen, can also contribute to hair loss as well.
So that would also contribute when we're talking about women that are doing braids and locks and things of that nature, stressing their follicle when they pull them tight.
Absolutely. Women also can deal with hormone-related hair loss, but it's pretty common actually to see the temple area for women who are consistently wearing super tight ponytails or braids, sort of lose some of the hair from traction alopecia. The good news with alopecia, traction alopecia, or another type of hair loss that's called telogen effluvium, which is sort of the result of like a shock, and probably the most common would be getting sick, is most of that hair will grow back if you stop either wearing your hair super tight, or once you go through a couple hair cycles post sickness, a lot of that grows back. But if you're a man and you have androgenic alopecia, you have a much harder fight
Okay,
to keep your hair.
When you're saying sickness or illness, what are some of the particular illnesses that people might experience that they are seeing this type of hair loss?
Yeah, I think the most notable is COVID. There was a lot of buzz around the COVID era with hair loss. It was probably one of the most common researched questions by people, so Googled, was why am I losing hair after COVID? And the short answer is telogen effluvium. And like I said, the good news is after a couple hair cycles, almost all of that hair or most of that hair will come back.
So how long is a typical hair cycle?
It depends person to person, but it could be weeks to months until you see the density come back. But yeah, there are things you can do, I guess across the board, whether it's traction alopecia, androgenic alopecia, or telogen effluvium from a sickness that can start to regrow or increase the speed at which some of that hair comes back.
Okay. So let's talk about some of the solutions to these problems.
Yeah, so it's interesting. I've told you this story before, but I sort of had my introduction to hair loss research when I was in undergrad, and I was doing an animal study on mice, and the mice were shaved completely, and we applied a microneedle therapy to the back of these mice, and the goal was to heal wounds. But one of the incidental findings, so something that we weren't expecting, was that they sprouted a ton of hair where we treated them. And so that was my introduction to regrowing hair. But you can think of addressing hair loss, and I'm going to switch to more broadly androgenic alopecia.
Okay.
You can hit it from three angles, and from a medical perspective, hair loss is generally something that we would say you throw the kitchen sink at.
Right.
You want to do as much as possible to preserve as much hair as you can, as quickly as you can. So obviously, the earlier you start these interventions, the better the outcome, right? It's much harder to keep your hair, or it's much easier to keep your hair than it is to regrow your hair.
Okay.
So those we call them the big three, and the first of the big three is shampoo, which is most commonly sold as Nizoral, and it contains an active ingredient called ketoconazole, which is it's a 5-alpha DHT reductase inhibitor. So
say that one more time.
5-alpha DHT reductase inhibitor.
That thing.
Okay.
Okay.
And that essentially prevents testosterone from shrinking hair. So that's a really easy thing you can buy at Walmart, at Target, at any store, and immediately implement it. And that targets the androgen side of male pattern baldness or male hair loss. The other two of the big three are minoxidil, which people probably know as Rogaine. And then the third one is finasteride or Propecia. So these are slightly different. Minoxidil is probably the most commonly used and most studied hair loss treatment out there. And it's pretty simple. It comes in either a foam or a liquid, and it essentially just vasodilates. It increases the blood flow to the hair. And so that alone has been shown to significantly impact the regrowth and the density of hair.
So, just to recap real quick, blood flow is hair is fed internally, except in certain cases where you can add topicals. But most of the time, with this topical, it helps to actually increase the blood flow.
Right.
With a topical product.
Yep.
Not an internal product.
Correct.
So some of the other things you're talking about are internal projects.
Right.
Okay.
So minoxidil can either be applied topically, and you can also buy topical minoxidil at Walmart, Target, wherever. But you can also use oral minoxidil, which is a prescription drug. So if you are facing hair loss and you want an early intervention, it might be worth having a discussion with your doctor or dermatologist about oral minoxidil. There are some considerations. Obviously, if you're orally ingesting it, it is a prescription drug, so there are side effects that are associated with it.
Ooh, time out. Side effects. Let's talk about some with the particular oral or the topicals. Are there side effects with the topicals?
Yeah, so the most common side effect with topical minoxidil is just dryness and flakiness of your scalp. And that's usually transient, meaning it usually resolves on its own over time. And it's pretty uncommon to have these adverse events or side effects with minoxidil. And the third class, Propecia or finasteride, is also a prescription drug that you would have to get from a doctor, from a physician, that is an oral 5-alpha DHT reductase inhibitor. So with those big three, you're targeting the oxygen component. So you're essentially adding oxygen and nutrients to your scalp with minoxidil. And then with ketoconazole and finasteride or Propecia, you are discouraging testosterone from shrinking your hair follicles.
Okay, now finasteride is also used for other things, right? In larger doses. Like I know for a lot of men dealing with prostate issues, they use finasteride to relax the prostate. So with men that are using those types of products, would that be a byproduct of using those when they're operating under the guise of their prostate issues?
I mean, it could be an inadvertent benefit if you're dealing with hair loss and you're on these drugs for prostate issues, but I think for the most part, the doses that you're taking for hair loss probably don't affect the prostate dramatically or significantly.
Okay.
But they do also come with side effects. There's Propecia syndrome or finasteride syndrome. Also extremely rare to have that happen. But in general, I think all of those treatments are regarded as mostly safe and very effective at either stopping, slowing, or even reversing hair loss.
Okay. Are there some instances where you just don't suggest people take different types of treatments because they just have really bad side effects or just are like myths?
Yeah, I think you have to take it by a
Case by case?
a case-by-case basis. Obviously, you'd want to talk to your doctor. If you know, in the case of hormone modulation, so Propecia or finasteride, there are other considerations like knowing where your hormones are at, which your doctor can also help you get to. But for the most part, I think the majority of men with androgenic alopecia seem to benefit pretty dramatically from those three interventions. But I think, a hidden gem, I've talked to you about this a lot, that is not really considered a big three, or maybe now it sort of is now that we've learned more, but there is an element of creating small wounds in the scalp that grows a lot of hair.
Okay.
A lot of hair.
Talk a little bit more about that.
Yeah, so I remember in graduate school, we reviewed a case report of an older man who was completely bald, no hair at all. Obviously except on the sides, but none on the top, none in the crown, and the guy got severely burned. He burned the top of his head, and once the burn healed, he regrew almost all of his hair. Right.
So almost like when they burn down a forest, it comes back.
Grows back. Right. No, by the way, I'm not recommending you burn your scalp. But there are other things that you can do that sort of get use that same pathway.
Okay.
So the most common and arguably the single most effective treatment for regrowing hair is microneedling.
So describe what that process looks like.
So microneedling is sort of what it sounds like, where you have a device that has an array or a bunch of small needles, and you're essentially just poking the scalp in the areas that are losing hair. And you can buy microneedles online, in stores, over the counter.
So this is a process you can do yourself at home?
You can do this yourself. And this is the most powerful method for regrowing and keeping hair.
All right, for those that are squeamish, is it a painful process or is it something that is bearable to, like people give themselves injections for, diabetes and things of that nature? What would it be comparable to?
It hurts a lot worse than that.
Oh.
So it doesn't feel good.
All right.
And there's multiple different devices. The three most common would be what's called a derma roller, which is, you can think of it like a wheel with little needles on it.
Okay.
So you'll basically roll it through your scalp, through your hair. There's a stamp, which is basically a stamp with microneedles. Yep. And then there are mechanized, motorized microneedles, which are the most expensive, but also probably the most effective.
Okay, which is the least painful?
Um,
Or are they all about the same?
So I think it depends on the size of the needle
Mhm.
and on the depth that you push it. So one benefit of mechanized microneedling is it has adjustable microneedle depths.
Gotcha.
So the most optimal depth is 1.5 millimeters, but that is also pretty painful. Like, that would draw blood.
So that's the equivalent to pricking your finger for blood testing.
Right, it would be around that depth. And it hurts, and you will bleed. That being said, a depth of like 0.5 or 0.2 is not going to go as deep, but it's still going to give an advantage.
Okay.
So if you can't tolerate the pain of 1.5 millimeters, you can always go to 0.7, 0.5, or even 0.2.
Okay.
And for some background, there was a pretty recent clinical trial comparing just minoxidil alone versus minoxidil and microneedling. And the group that had both microneedling and minoxidil had around 12 times more hair growth.
So when you're speaking of the hair growth itself, what is to be expected in time frames?
So each of the interventions that we've touched on have different, I guess, expectancies with their effect.
Mm-hmm.
Some people would say that minoxidil sort of peaks around 6 months, where in the sense of you will regrow hair for the first maybe 6 to 8 months, and then it kind of plateaus. And that being said, if you stop taking these drugs or these interventions or supplements, you will lose your hair at the same rate that you previously were. So
it's a life ongoing
Right.
process. Okay.
This is a commitment, and ultimately it comes down to how badly do you want to keep your hair, or how badly do you want to regrow your hair. For microneedling, it takes anywhere from 3 to 6 months to really start to see results. And I think if you're consistent, by about a year, it would be visibly noticeable to other people.
Okay. So when you say consistent, how many times a week or a day would you go through this microneedling process?
Yeah, this is a great question. So oral minoxidil, we'll start there, would be usually once per day. Topical minoxidil is recommended twice per day. once in the morning and once at night. And by the way, if you style your hair, I recommend using minoxidil foam
Okay.
because the liquid is pretty oily and that makes it hard to style your hair.
Okay. Okay. Okay.
So that's twice a day, at least once a day thing. Finasteride or other oral 5-alpha DHT reductase inhibitors. It depends on the dose, and it could be every day or it could be every 3 days. And it sort of depends on the regimen that your doctor puts you on. And for microneedling, it's generally advisable to do it once per week, especially if you're going to deeper depths like 1.5. You want to give your scalp time to heal.
Okay. Okay.
And that being said, could you do it twice a week? Sure, I know people, and I'm familiar with studies that do that more frequently.
Mm-hmm.
But the main issue with microneedling is compliance, right? It's hard to will yourself to, microneedle your head.
Harm yourself.
It
every
hurts.
day.
Yeah.
Yeah.
And a really weird side effect of microneedling is sneezing. So if you're doing this to yourself and you start sneezing, it's not a weird you thing. This is pretty common.
Wait a minute. So if you're doing the microneedle process on a regular basis, you start sneezing. Is it uncontrollable sneezing?
Just when you're doing it. Just when you're microneedling.
So you're probably touching some type of nerve that generates that effect on you?
It triggers some kind of response, for sure.
Okay.
But that's sort of the gist. With ketoconazole or Nizoral, the shampoo, it's generally recommended to do it between 1 and 3 times a week.
Okay. So, with these different treatments, excuse me 1 second. How you doing, young man? I'll be right with you.
Thank you.
Generally, just doing the treatments on your own. Do some people actually go to the doctor for these type of treatments, or is there a clinic where I'm unable to give myself this needle every day, and I can go somewhere and they'll actually perform it for me on a regular basis?
You could. I think it would be not super practical. And the reason why these, the big 3 plus microneedling is so popular is because you can do it at home.
Okay.
But you do bring up a good point, which is there are, well, I guess what we would say more invasive or more involved options.
Okay.
So, and you would have to see a doctor or a healthcare provider for these, but they could include PRP,
Which is?
platelet-rich plasma. So you'll go through a process where they draw your blood and they spin it down and they isolate growth factors and they would re-inject them into your hair.
Ooh.
So this has some pretty decent evidence as an effective injectable treatment. And then there's a relatively new intervention called an exosome. And these are secreted by stem cells, and they're usually microneedled into your hair.
What's
by
the cost associated with stuff like that?
way more expensive than magnitudes more expensive than the big 3. It can cost thousands of dollars. So these would be things that you're probably doing once a year or once every 6 months if you can afford it. That being said, the evidence for how well they work is good, but the big 3 still have the overwhelming majority of evidence behind them. So can you effectively address hair loss without spending thousands of dollars a year? The short answer is yes.
Okay. So, in some of the other measures that people are taking, like hair replacement. So, what are your thoughts on that?
In terms of like a hair transplant,
Hair transplant.
yeah, I think this is frankly the gold standard. There is probably no better treatment than a full hair transplant. But again, that being said, if you do get a hair transplant, it will not, the hair that you transplanted after, several months, you're not going to lose it with, like you would the rest of your hair, but the rest of your hair will still continue to fall out unless you implement another protocol to keep it.
Okay.
So while it is a very, very solid option, it's likely that whatever surgeon is doing a hair transplant is going to recommend that somebody is put on finasteride or Profacia because you want to keep, it's an investment
To
in
maintain what
exactly.
you're doing.
Yeah.
Okay. Okay. So, big. I want to clear up a myth. Where is the hair being transplanted from to the affected areas?
Usually somewhere else on the head. So you'll notice with male pattern baldness that the hair on the sides and back generally is unaffected. And that's generally where they're going to take it from. They call it a donor site.
Okay.
But I've seen hair grafted from a lot of different places.
Ooh, let's talk about that. where else do hair get grafted from?
I've seen it from the face.
Okay.
I've seen hair grafting onto the beard.
Okay.
And by the way, I should add that minoxidil and microneedling is also a really attractive option if you want to grow a thicker beard. Yeah, or fill in a patch in a beard.
Never knew that.
Yeah.
Okay. Good information.
But by and large, most of the hair that's transplanted is coming from a donor site on the head. Yeah.
Okay. So no butt hair and
None of that.
Okay. Okay. Good.
Hopefully.
Good. Good. You know, you hear a lot of stuff in the barbershop. I'm just trying to clear up some of the misnomers and the myths that go through. You know, somebody then got hair transplanted from the nether regions. But how, in your experience over the years, when you're teaching and training other people, your main three go-tos are the big three that you mentioned earlier.
Yep.
Okay. Okay. So, is it a difference in black hair versus white hair? You know, when you're considering these options, are there things to consider in that space?
I don't think there's a big difference in the responsiveness to the big three based on race. A lot of it is genetics. I've seen people that have terrible response to all three from each race, and I've seen people who had amazing response from all three. So not that I've seen or noted.
Okay. So it's more just on a general case-by-case basis with how things work.
Right, exactly.
Good. Yeah, I appreciate you filling this in, especially with your expertise in this space. Is it, how can people contact you if they want to find out more about this, or some resources that they can go to get more general information or more specific information if they want to look at this as an option?
Yeah, one of my really good friends who's sort of has developed a niche in hair retention protocols is Dr. Kyle Gillette, and he runs a clinic called Gillette Health. He does a lot of really good work, non-invasive work. If you want to contact me, my Instagram is probably the best, and my handle is @AlecMcCarthy PhD, and I'm happy to talk all things hair loss and studies. If you want resources, I think obviously you can't go wrong with Google, but a little trick is to go to Google Scholar, and this is where you'll find studies.
Okay.
And let the studies and the body of evidence sort of guide your decision making.
Okay. So just to be clear, there's dermatology, and then what is the difference between dermatology and hair dermatology? Because I found a lot of clients trying to get information from dermatologists, and they're not as knowledgeable. So what are the difference between the two?
Yeah, also a really good question. A lot of it honestly comes down to experience and interest. So some dermatologists are super specialized in hair. Some facial plastic surgeons and plastic surgeons that do a lot of hair transplants are really knowledgeable. And it really just comes down to their experience and how much time they've invested in it. You might interact with a dermatologist who specializes maybe in psoriasis, who doesn't deal at all with hair, and you might see another dermatologist that is a world-renowned expert. Most healthcare providers that deal in this space are very knowledgeable. So it's really about who can you access, you know, I guess locally or regionally, and who listens and who is willing to, you know, try new things. And I think as a general rule of thumb, most providers that are treating hair loss are going to have a multimodal approach, meaning they're not just going to start with one intervention and hope that it works. I think most experienced hair loss doctors understand that this is, you know, there are multiple targets to keeping and growing hair. So
And be aware that, you know, a lot of this stuff is trial and error.
a lot of it is trial and error. You could find that, you know, just on minoxidil alone, you're a great responder. You might need all 3 or 4 interventions to keep or regrow the hair that you've got. But you know, the I think the good news is there's been so much research on hair that there are a lot of options.
So what you're telling me is being bald is an option.
Being bald is an option.
Okay, all right. Well, now that we've concluded our tutorial on hair loss, maybe next time, if there's something else that you feel like, you know, we could benefit from your expertise, we'd love to have you back doing this again and helping us figure out, you know, all things hair. Barbershop therapy, this is where we get through the call. Appreciate it, sir.
Of course, thank you.